Hi, everyone. Welcome back to another episode of Heart to Heart. As you all know, this is a series on IGTV and now on YouTube that my co-host, Dr. Ambreen Mohammed, and myself, Dr. Amisha Gupta, started to really talk to today's physicians about their journeys through medicine. Today, we are thrilled to have my colleague and friend, Dr. David Werho. Dr. Werho is triple board certified, having completed training in pediatrics, pediatric cardiology, and pediatric intensive care. He now practices as a cardiac intensivist in the CT-ICU. He is an assistant professor at UC San Diego, associate program director for the fellowship program for pediatric cardiology, has previously been an early career blogger for the American Heart Association, and is well known for his diversity, his activity, and his advocacy in national committees such as PC4, also known as Pediatric Cardiac Critical Care Consortium, and the PCICS Society, which he is even an executive producer for their podcast. So David, welcome, and thank you so much for being on our series today.
Thank you both for having me.
So just to get started, we like to ask everybody the initial question of what got you into medicine? What really got you into pediatric cardiology and pediatric intensive care?
Sure. So actually in college, I was pre-vet. So I was going to go to veterinary school. And then one day I was a stable boy and I got kicked by a horse, and I realized that people kick a lot less harder than horses. So I sort of changed my course at the last minute and went into medicine instead, because obviously the physiological concepts and everything are very similar, but obviously you can do a lot of things with people that you can't do with animals, such as talk to them and form lasting relationships and watch them grow and develop over time, which also sort of lended itself well to going into pediatrics and then ultimately pediatric cardiology.
And what got you interested in intensive care?
So I just love physiology and seeing physiology in action. And I tell trainees this all the time, that the pediatric cardiac intensive care unit is really like probably the place in a children's hospital where you see physiology in action more than anywhere else, except maybe in the cath lab or in the operating room. So even more so than general pediatric critical care, obviously there's a lot of physiology as well. But when you have patients with critical heart disease, any perturbations, even like 5 cc's too much of fluid, can actually make a huge difference. And so really understanding those core physiological concepts and seeing them in action is kind of what guided me towards pediatric cardiac critical care. I think the other thing is that I am not an outpatient person. I cannot do clinic, and but I still want to see my patients grow and develop over time. And I think pediatric cardiac critical care is one of those unique fields where you have patients who come into the hospital frequently and repeatedly often, especially the single ventricle cohort who have multiple surgeries that are sort of planned over the course of their early life. And so you do get to see them grow and develop and eventually come back when they're well, just to say hi and run around and that kind of stuff. So it's kind of the best of both worlds, the best of pediatric cardiology, also the best of pediatric critical care.
Yep. And I just have to put in a plug that, our cardiac intensivists are some of the smartest people in the hospital. So good job, team.
As an adult cardiologist, I have a lot of respect for both of you guys, but especially in the critical care realm. I mean, I know, I've done plenty of rounding in the, cardiac intensive care, and I love, CCU medicine, but it's so funny. Anytime you give an adult cardiologist anything to do with congenital cardiology, we literally, our heads explode. Like you actually see smoke and fire coming out. Like I remember I was studying for echo boards, and I was like, our whole entire class was like, I don't know if we're going to survive if like there's going to be a good amount of congenital, because we're not exposed, to any of that stuff. So seriously, kudos to you guys, because that's, it's very complex stuff. And like, I totally agree. You're dealing with some of the sickest patients and most complex patients in the hospital. So that's amazing. So, Amisha had stated a little bit before that you're very, you advocate for a lot of diversity and inclusion, and you've done that in the past. And so, as I'm sure you know, especially over this past year, 2020, and, in the realm of medicine and a lot of the specialties, including cardiology, that are very, it's known to be very male dominated and not diverse in terms of people of color and women. What changes do you think we need to make moving forward in order to further diversify the field with, like I said, not only women, but also people of color, and not only in adult cardiology, but also in pediatric cardiology?
Sure. I mean, it is a very important issue, and obviously it's a hot button topic at this point in time, which is great. I think one of the things that's very different in pediatric cardiology versus adult cardiology is the gender diversity is a little bit more balanced in pediatrics. And obviously, like in my residency class, I was, one of a minority of male residents because a lot of pediatricians are females. However, despite the majority of pediatricians being female, in pediatric cardiology, it's actually about close to a 50-50 split, which I think is still absolutely fantastic, but it is not representative of, all pediatricians. So I think obviously with time, I think that's going to continue to grow. I think if you look at the workforce and the training numbers, the number of female trainees who go into pediatrics and then subsequently go into pediatric cardiology is increasing. So I think that's great. I think probably the adult world is a little bit different because internal medicine is a heavily male, a majority male dominated field. And so I think sort of related to that, cardiology in adults is also going to be heavily male dominated. So I think, unfortunately, it's a pipeline issue because I think, if you don't have great diversity in the categorical training programs, then you can't have a diverse pool to recruit from into the subspecialties. And I think that's one of the things we see. So specifically in my field, in pediatric cardiac critical care, actually the majority of practitioners now are females, but in leadership, that's not the case. The majority of leaders are males. And same thing when it comes to race, there's just very little racial diversity. But obviously, going into a field like mine, it's, a pediatric or a residency training program, followed by a fellowship, followed by another fellowship or a super sub fellowship. And so I think, every step along the way, we have to be very mindful that we have to really mentor and recruit people just from the ground up who have diverse backgrounds, who obviously have gender diversity and also diversity of experiences and racial ethnic diversity as well. Because as we know, all of our patients are better served when they have care providers who understand their cultural background and where they're coming from. And I think that that's just something that as we continue to develop as a field, not specifically cardiac critical care, but in cardiology in general, I think we need to focus on that more and really focus on the beginning of the pipeline. So medical school, residency programs, and then go from there.
Yeah, absolutely. You make a really important point about, going from the beginning of what you're calling the pipeline. So, you were saying residency, but also mentioned medical school. And I really do think it starts with medical school. It definitely, you have to make sure that you're giving these people opportunities. There's a lot of people that don't have similar opportunities. Not everybody's on a level playing field. So, we have to make sure that we, do outreach in different communities, maybe from, people that have like a lower socioeconomic background, and give those people better opportunities so that they will be able to, thrive and become doctors. And if you go into a lot of these communities, you speak with a lot of these people, they have the same dreams and aspirations that we all do, right? It's just that we've been given that fortunate opportunity. And unfortunately, a lot of these people can't afford, going to school or, whatever the case might be. It's not like medical school is a cheap ticket, right? We're all in a lot of debt right now. So, like you said, just being given the opportunity, it's amazing to see how people can thrive from that. And it also changes outcomes, right? Because you're right. It's actually been studied that patients that have, doctors of similar backgrounds, and this especially has been studied with the African-American population, they actually have better outcomes because they trust their physician more, they put their trust into their physician more, and they're, better able to be managed and actually have better outcomes with their, with their prognosis. So absolutely.
Yeah, definitely. And you
Let me pause there for a second.
in and out.
Yeah.
It
There
is.
you go. You're good. You're good. It's okay.
Sorry about that. So what I was going to say is that, you touched upon this, but every specialty has their own distribution, right? Of what's,
Oh gosh.
an advocate, not only in the field of critical care, but also for trainees as well. So what advice would you have for others striving for leadership positions? And as an associate program director, what is your advice for students and trainees on how to pursue and excel in their interests?
Sure. I think you cut out for a minute there, but I think the general sense is that you want me to talk a little bit about how people take advantages of how people take advantage of opportunities to really grow, not just within their specific field, but really to outreach and have advocacy, and also to get involved on a more national scale. And so I think a lot of it, unfortunately, is luck. I think, so I just have been at the right place at the right time in a lot of situations. When I was first, actually not first, but I was finishing up my second fellowship, and it just happened to be in the time frame where a lot of the national organizations were recognizing the importance of communication, social media, connections, and collaboration. And so because I happened to be young enough to understand, the basics of the technology and a little bit pliable in my ability to pick up the skills necessary, but also experienced enough that people knew me and understood that when they asked me to do something, that I would get it done reliably. I think that's why I ended up in the situations that I ended up in, where people said, you know what, we really need to create a podcast, or we need to have social media for this organization, and or we need to have this committee to put together all these educational resources on a more national scale. And so they thought of me because I had that experience and track record with people and mentors and leaders in the field who kind of trusted me to do those things. I will say I had absolutely no interest in social media. I did not get a Twitter account until I was forced to get one. And really, I was, literally, I grew up in the MySpace era. So, even migrating to Facebook was a late decision for me. So I think I'm a little bit an old fogey in a way, but I think just being able to take up those new things and say, okay, I don't really know what a tweet is, or how to log into Twitter even, but I'm willing to learn, and I'm willing to put myself out there and to do these things like coming up with a podcast and all of the technical skills that are required for that. I really had no idea, but I was willing to learn. And so I think that's sort of what got me where I am now. I think the important thing really is putting yourself out there and being willing to take a little bit of risks, but make sure that you aren't taking on too much where you end up getting in a position where you can't deliver on the things that you've promised on. And so I think that's really important. But the answer to your question is really a lot of it is luck and having really great mentors and career sponsors who are going to suggest you and give you the opportunities. And then as soon as you have the opportunities, it's important to follow through on them.
Yeah, absolutely. I think the follow through is key, right? Because sometimes I think it's interesting now with Clubhouse on top of Instagram, on top of Twitter, on Facebook is something that, that the three of us maybe didn't have when we were in training, that a lot of students and trainees have now, is that access, right? That opportunity to find somebody and ask those questions and maybe ask to be a part of a project and go from there. But I do think that with having all that access is really important for students, trainees, physicians, attendings, whatever, that we maintain our follow through, right? Because that is what is going to define you. And like you said, that's going to either propel you to the next opportunity or, keep you where you're at. So I think, you brought up some great advice points for our audience, definitely.
Yeah, absolutely. And just to echo what Amisha said, and to kind of go off of what you said too, I mean, absolutely, like a lot of it is luck, but it's like what you choose to do with it, right? Like if you might be given all these opportunities and you might say, yeah, I'm lucky, but clearly the reason why you're still where you are and you're still continuing to get opportunities is because you're doing something really great with all the luck that you've, been given. So got to give yourself a little credit there. You've clearly demonstrated that you're more than capable. And that's the thing. I mean, Amisha and I have realized even in the short time that we've been doing this is that I think people are starting to realize that we're just two eager beavers that are just literally willing to take on anything. But we get so excited because this is just like a whole passion project thing for us. And it's really opened so many doors that really, we still kind of consider ourselves two nobodies, because really, who are we? But really, initially, we were two nobodies, and we were just, thinking like, these people will never talk to us. And now these people are people that we can call our mentors and colleagues and friends, and it's incredible. So, absolutely, it's what you choose to do with the opportunities that you are presented with that really can, make your career take off. So, as a final question to you, David, you clearly have a huge national presence in a lot of these different, societies, as we've kind of been echoing throughout this whole talk. So, how do you think, or how do you feel about involvement in national societies to elevate one's own career, and even with social media? Even though you said you've kind of been a little bit late to the game with social media, even I am. I don't know what Clubhouse is, Amisha. Maybe I will one day. But
me neither.
How do you think that involvement in these societies, as well as social media, can really help elevate one's career?
Yeah, I think similar to what I said in the last section is that really the people that you connect with and that sense of connectedness within your field is so important. And I think that something that trainees have now that, like you guys mentioned, we didn't have when we were in training, is that it really is at your fingertips. And I think that's such an important part of social media, is really being able to have those active connections and communication with people who are leaders in the field, people from different journals who are, posting the most recent literature. I think it's a really good way to keep up with, what the conversation is regarding like the medical literature in your field, and being able to have those interactions where you see maybe like an infographic and you think, oh, this is interesting, and you go to the article and you read it, and then you have those authors there sort of at your fingertips to talk about. And if it's something that you're interested in as far as like research or even using like in a clinical setting, I think it's really important to the trainees now that they have the ability to reach out. But I think as far as involvement in national organizations, I think, again, getting involved early is very important, because a lot of them, I do have some fantastic mentors and sponsors who are from my training programs, but I will say that probably just as many opportunities as were afforded to me from those mentors and sponsors, probably just as many were given to me by mentors and sponsors that I met through national organizations who I've never actually physically worked with clinically on anything, but are people that I've connected with at meetings or within societies or on committee memberships, and then have collaborated from there. And so I think it's really important for trainees to take advantage of any opportunities with national organizations, because a lot of places have, trainee liaison positions, or will allow trainees to join their working committees. And I think that's a really good way to sort of get your foot in the door, get some experience working on a collaborative project, or project management, or whatever it may be, on a national scale, and then sort of use that to take the next step in your career and leverage that for other opportunities, as long as you have a strong interest, and like I said, you're not biting off more than you can deliver on. So
absolutely. So you made some wonderful points during this whole entire talk, and we're so happy that you have been able to take some time out during your day to talk with us. So do you have any lasting words for our audience that you would like to share? Make it good. Just kidding.
No, I think really just being eager and following through is the most important thing. And I do want to say thank you both for having me. I think these discussions and all the topics that you bring up on Heart to Heart are so important. And I think it's really great that trainees have access to this, because I think it, in a way, even though, we're not going to see who the people are that are watching this video, but somehow, hopefully, it can impact someone's life and career and training pathway, and they can say, hey, I want to do something like this as well. And obviously they can always reach out to us, but they can sort of take advantage of the opportunities at their fingertips and reach out to the people that are going to be important to help develop their careers.
Absolutely. So, David, if somebody wanted to reach out to you on social media, where can they find you?
Sure. The easiest way probably is Twitter. My Twitter handle is at DWERHO, at DWerho. Or I guess that's probably the easiest way.
We're waiting for you to join Clubhouse.
Yeah, I'll send you an invite for Clubhouse soon.
Okay, I don't know what that is, but
you're going to soon find out. All right, guys, thank you so much. We had so much fun talking with David today. And thank you guys again for joining us in Heart to Heart. And we'll see you guys next time. Bye.
Bye. Thank you.